One of the most common questions asked from people suffering from piles is that if they need a laser treatment or not. But before I answer the questions, let us look at the various options available for people suffering from piles. Non-surgical treatments for piles include self-care measures using topical treatments like creams and suppositories, and minimally invasive procedures like sclerotherapy, rubber band ligation, infrared coagulation, and laser treatment. These are non-surgical treatments typically used for mild to moderate cases of piles and can effectively reduce the symptoms and shrink the piles. Surgical treatments such as hemorrhoidectomy are typically reserved for more severe cases and have not responded to non-surgical treatments. Hemorrhoidectomy is a surgical procedure where the piles are removed, usually under general anesthesia. Now, let's come to what laser treatment is and who is it recommended for. Laser treatment is a minimally invasive procedure that uses a beam of light to shrink the piles and seal the blood vessels, thereby reducing the bleeding and relieving the pain. During the laser treatment procedure for piles, the patients will lie down on their side or in the prone position. The doctor will administer local anesthesia to the affected area. A small probe is then inserted into the rectum, which emits a laser beam that is directed at the piles. The laser beam targets the tissue in the pile, causing it to shrink and seal off the blood vessels, thereby reducing the bleeding and relieving the pain. The procedure typically takes less than an hour to perform. In India, the laser treatment for pile has a success rate up to 93%. This treatment is typically recommended to people who have not found relief from other conservative treatments such as changes in the diet, lifestyle, over-the-counter medication, and other non-surgical treatments. Laser treatment may be appropriate for people who have moderate to severe cases of piles and are experiencing significant discomfort or bleeding. However, it is important to note that not all cases of piles are suitable for laser treatment. For example, laser treatment may not be appropriate for people with a very large or severe piles, those with a history of anal fissures or fistula, or those who have had previous anal surgery. Additionally, this treatment may not be recommended for people with certain conditions such as bleeding disorders or immune system disorders. A lot of patients are interested to know what happens after the procedure. After the procedure, patients may experience mild discomfort or bleeding for few days, but this is typically temporary and can be managed with over-the-counter pain reliefs and proper self-care measures. Ultimately, the decision to undergo laser treatment for piles will depend on the severity of your condition, recommendation of your doctor. Thank you for watching. For more information of piles treatment, consult with your healthcare provider.